It's 21 minutes past 6. We're asking, would you take health advice from your hairdresser or lifestyle tips from a barman? Well, it may sound far-fetched, but a report today says we can't just rely on NHS staff to look after the health of the nation.
No, instead, the Royal Society for Public Health is calling on workers from a range of sectors, including librarians, cleaners and firefighters, not to mention bar staff, to spread public health messages, which could keep people out of GP surgeries and hospitals.
Breakfast Jane McCubbin has more.
So how's things, Boxer?
Yeah, well, good, man, you know, just living, surviving.
Jay's Barbers in Birmingham is at the heart of the community.
You must get it all coming through these doors, Jay.
We get all sorts coming through the stores, so they feel better when they talk about it. Yeah.
A report out today says people like Jay should be harnessed and trained to help spread public health messages.
Yeah.
Jay is a good listener and is a guy that gives good advice. It's true, man. It's true.
I'm not just a barber slash therapist.
Slash agony aunt, slash consultant.
Oh, gosh.
The vision is a public health workforce of millions of people like Jay.
What's that?
There are 15 million people in the UK who have the opportunity to help and support, improve and protect, actually,
Out
the
in
public
communities
health.
like this,
Out
not
in communities like
in the
this.
doctor's surgeries,
No.
not in the hospitals.
No, people in all sorts of occupations that you might not actually think of.
Some will say, shouldn't we just spend more on allowing the professionals to do their job?
Well, I don't think this is about doing it on the cheap. It's about who's actually in the community talking to people.
Do you see the same faces over and over again?
In this city centre bookmakers, Alex tells me he's talking to regular clients on a regular basis.
Yeah, I do consider a lot of people here like good friends, and so if someone opened up to me, then that's something that I've got to respect and deal with, yeah.
Amongst his customers today is Simon. He tells me he's homeless, a paranoid schizophrenic, a manic depressive.
You pop in and out of here regularly. I mean, the people you see here, do you see them more than your GP?
Yeah.
Do you ever see a GP?
No.
£3,000.
The company say they already train staff to help clients with mental health issues. Exactly the kind of help the report calls for much more of.
I've got to say, Alex, that there'll be people watching who think the last place I want to take mental health advice from is the bookies.
Sure, I mean, we're not saying that we're doctors or we're qualified to actually fix the problem. What we're saying is because of the relationship that lots of our customers have with the staff, they can provide information, they can provide signposts and point them in the direction of where they will get that advice.
This is big society for the health sector. Karen, who works for a local social enterprise here in Birmingham, believes it will work.
There's a real good community spirit, and if you're working in the communities, people want to help each other and feel more comfortable with a familiar face.
But the big society idea comes after big cuts. 200 million was recently sliced off the public health budget. Sources within the NHS told me this is a cheap alternative to a professional service. Report authors, though, say it is recognition the NHS can no longer do it all. Jane McCubbin, BBC News.
Oh. I'm slightly confused by that. If you want financial... No, I was confused. We get financial advice from a bookie. Is your bookie going to say to you, oh, you're looking a bit peaky today, and it's because you probably just lost a tenner? Or so I don't know. Fortunately, we've got somebody from the Royal Society of Public Health coming in later to talk about it.
He's going to clear it all up.
Yeah.
But perhaps it's good to talk. What do you think? Would you be comfortable talking to people such as your hairdressers or your bookies if you're in contact with them in daily life? Email us at bbcbreakfast@bbc.co.uk. Of course, you can share your thoughts with other viewers on our Facebook page.
You can tweet about today's stories using the hashtag BBC Breakfast or follow us on Twitter for the latest from the programme.
Still to come on Breakfast.